My name is Dr. Gary Edwards. I'm the veterinarian here at Gateway Animal Hospital, and this is Rusty. He is a Doberman pinscher that had his ears cropped, and his right ear is now not standing. He has been pre-medded, so obviously he's a little groggy, but he is the right ear is flopping. So today we're going to put the Tempostay implant in from Neuticles, and we're going to see if we can get it to stand. As you can see, the left ear, when he is awake, stands up very nicely and has good contour. The right ear has a break in the cartilage that is about a third of the way up the ear. So our plan is to put the Tempostay in and to get it to train the ear to stand. We're going to put the Tempostay in because that's what the owner wanted to do, was to begin with the Tempostay. If it doesn't train the ear to stand, we're probably going to come back and put the Tempostay in. So what I'm going to try to do is figure out where this dog actually has somewhat of a rolling break, and I think it's more just weak cartilage. You can see there it breaks there, but if I put pressure up, it just rolls. So my goal is to put that Tempostay and span that whole area. We're probably going to go from about, if you can see inside the ear here to here, and provide the support. So we're going to prep it now. I do want to send him home with some antibiotics. Let's do Cephalexin 250. Let's do 28 1 BID. Okay. Okay, open up the Tempostays for me. Does it say on there what length these are? I think that the owner ordered the longer of the two, so I think it's the 3 1/4, and then you can get it 2 1/2. There's what the Tempostay looks like, and what we're going to do is use these holes to suture in the Tempostay, starting on the inner part and spanning the distance of the weak cartilage. I will be using 3/0 monocryl to be putting it in place. My goal is can I get a taper needle, please? My goal is to probably initially do the first and the last suture line will be just through the skin, but my goal is to probably at least twice in the suture line with these holes is to actually pass the cartilage, pass the suture through the cartilage to provide more support. And the tension of the needles, or the tension of the sutures, is going to be depending upon where it is located. So we're going to go ahead and place the most distal suture here. Placing the suture through the ear. Cindy, if you can hold that ear right there. light tension on the suture. Hopefully not enough that we'll have any type of pressure necrosis or anything like that. Then I'm going to place my distal suture in the same fashion, or my most proximal suture in the same fashion. Passing it through the Tempostay. Alright, let's see how it stands. You can see obviously just with those two sutures in, it should stand nicely. We're going to go ahead and anchor this down probably either 3 or 4 more areas and try to at least purchase at least once or twice the cartilage, but without extending into the suture on the external skin on the ear. We don't want to create any scars. That one I actually did pass through some of the cartilage. I'll pass the next most proximal suture and actually grip some cartilage on that one. Pass it through the holes there. We'll pass the next to the most medial through actually the skin itself. And then the last one here. You can use these either in a situation like this where you don't have a ear crop that is standing, or you can use it in a situation post-surgical right after you do the ear crop and to prevent from taping. But you can see there how nicely that stands. We'll get some pictures after he's awake.